There is nothing more frustrating than having an ailment that keeps us from doing some of the favorite things that we love and also just getting us through our daily routines. And bad knees are one of them. But there are new treatments that could help change that. Dr. Dina Peterson is joining us from Noble Clinical Research and has more on how all of us and how we can help. Good morning, doctor.
Good morning, Heather. Thank you for having me.
Glad to have you back. So what are some of the studies that you're doing currently?
In general, my staff and I conduct FDA-approved research studies testing new medications because, as I've mentioned before, with the right medicines, people really can feel better and live longer. We nearly always have a study for knee pain from osteoarthritis. As the incidence of obesity rises, so does the incidence of both diabetes and knee arthritis. And these two are intertwined in that when a person suffers from knee pain, they find it difficult to exercise. And exercise is particularly important for people with diabetes because it helps control blood sugar.
Is there something new in this area that you've discovered?
Yes, but if I can, I'd like to talk for just a minute about the basics of treatment. Treatment begins with weight loss if needed and exercise if possible, because exercise strengthens the muscles that support the knee, and without good support, arthritis can develop or worsen. So treatment then moves on to medications like ibuprofen, but there are safety concerns with long-term use, and even in the short term, it's not great for people with diabetes or kidney trouble. Then there's the option of a steroid injection in the knee, but most steroid injections are short-acting, giving short-acting pain relief and causing fluctuations in blood sugar. So now drug developers are working on a steroid injection that is long-acting in hopes of providing up to 6 months of pain relief and stable blood sugar. And we have a study right now going on that is testing one of these long-acting steroids, and we're looking for volunteers.
A lot of this can't happen, and these developments can happen without volunteers. Is there a time commitment that people should be aware of if they're thinking about signing up?
All studies vary a little bit in their length, but typically they're between 4 and 12 months. And volunteers are compensated for time and travel efforts, typically between $500 and $1,000, depending on the amount of effort involved. Of course, they receive a fair amount of free testing. In this study, free x-rays of the knees, and nearly always free blood work and EKG and such.
Just to get some insight into the personal stories of people who are volunteering, do they feel the sense of, that they've really contributed to something bigger?
Almost everybody that comes in here has a sense that while they may receive a treatment and they personally may derive benefit from participation in the trial, that the bigger aspect is that they're contributing to helping advance medical research. And as I try to tell every volunteer, we wouldn't have any new medicines without people like them.
Where can we go to learn more about the study if people are interested?
So our website, nobleclinicalresearch.com, has more information on this and other studies that we're conducting. And it has a link where volunteers can register, put in their contact information, and then one of my awesome staff will reach out to them and answer any questions they have, offer an appointment if it seems reasonable, and so on. And of course, people are always willing to call, are always welcome to call the site. Phones do get a little bit busy sometimes. Please just leave a voicemail and we'll get back to you as soon as possible.
For somebody watching out there right now who's on the fence, what would you say to them?
On the fence, reach out for more information. See if the study is right for them. And if it's not, then it's not. But if it is, terrific. Come be part of our research family. Help us advance medical research to the best that we can, and go from there.
Changing so many lives. Doctor, thanks so much for what you do and being with us again.
Thank you, Heather. Much appreciated. Oh, may I just say before I go that I want people to know that we're committed to COVID prevention. We space appointments. We use hospital-grade germicide. We wear masks, and we ask volunteers to do the same so that we can all stay safe while we continue to advance medical research.
Important information. Thank you again.
Thank you. Have a great day.
You too. And if you'd like to learn more about the new studies at Noble Clinical Research, you can call them at 520-612-7860, or you can visit nobleclinicalresearch.com.